A couple leave hospital with their new baby, just a few days old. There's nothing very unusual about that. It happens about 1,500 times a day in the UK alone. But this baby, called Lily, is 1 in 100.
Thanks.
Along with her father, Simon, and her mother, Libby, she has a very special history. Libby and Simon had been married for 2 years when they decided to start a family. But after about 6 months or so, Libby hadn't become pregnant, and they began asking themselves what the reason for that might be.
I just had this gut feeling that there was a problem, and as most women do, I assumed it was me. I got an appointment with a gynaecologist, and he said, I really think you've got nothing to worry about. I think you're just getting yourself into a pickle over nothing. These things take time. You know, you've only been trying for 6 months. But his parting shot to me when I left his offices was, you know, it takes 2 to make a baby. Perhaps, you know, Simon should have himself checked out.
Simon was 34 years old. He was fit and healthy, and he didn't imagine there could be a problem as far as he was concerned.
So I went to be tested. It's really funny. You kind of, you have to give a sample, obviously, and they encourage you to do it at home. And then what you have to do is you have to get it to the hospital within about an hour or something.
Oh, that's something
or half
shorter
an hour
than
or something.
that. It's like 30
Still has
minutes.
to be warm, fundamentally. And so Libby was really obsessed about keeping it warm. So she made me take the sample, which is in a little pot.
But having been made to stand in the bottom of the garden while you're in the house doing your sample,
bit. Yeah,
yes.
good, thank you. Anyway, so she makes me wrap up this sample with a hot water bottle with a tea towel around it so it stays warm.
Speed was important, because after only a few hours outside the body, sperm start to die.
I then charge off to hospital, deliver this, unwrap this sample and give it to her and say, look, here we go.
Libby and Simon had to wait 2 days for the result of Simon's sperm test. He had no idea of the bad news that was in store for him.
We went in together and she just turned to me and said, you know, we've got the results to your test. And I'm afraid...
Make sure you say her exact words, because it was just...
Yeah, all right. And she said, you will never father a child. That's what she said to me.
Those were her exact words. You will never father a child, full stop.
And it was like kind of the world had just been ripped down. I felt my stomach, I just have that hollow kind of sick feeling. And partly because it was so unexpected, because as Lib said earlier, you know, it's...
Well,
you do
assume
it's terrible, but it's going to be, the problem's going to be with the women. You don't hear anything on the telly about blokes and infertility and all that kind of stuff. So it just didn't cross my mind.
The test had revealed that Simon's sperm didn't look like this normal sample, which has more than 20 million healthy sperm in it. Under the microscope, his sample looked more like this, with hardly any active sperm at all.
So it was, 1, a complete surprise, and 2, to know that it is you, and all our efforts that we've been to try and have a baby were for naught, was, you know, horrible. And it was a really terrible, terrible few moments, and, you know, I mean, I cried, it was awful. I was just so upset. Lib then took over, because I couldn't really talk, but Lib sort of said, look, so what are the results saying? She said, well, there's nothing there.
Libby used the internet to look for help, and eventually she contacted the London Fertility Centre. She and Simon enrolled for a treatment called IVF, in vitro fertilization, which uses science to help couples have babies. Libby would donate an egg, which would be fertilised outside her body with sperm from Simon.
We went together, obviously, to go and see this guy, and he says, right, you know, pop behind the curtain, Mr. Eichwald, and drop your pants.
The first step for Simon was to have his reproductive organs thoroughly checked out.
So you kind of get up on the tabley thing, and I wasn't quite sure what he was going to do, but there you are, kind of lying back. And first of all, he did kind of start on the easy stuff, which is checking out your tubes, which are obviously a bit higher up, just kind of squishing around, and that wasn't too bad. But then, of course, he grabs your testicles. God almighty.
The treatment for Libby started with a daily course of injections to help her produce as many eggs as possible.
It's a tiny little needle. I mean, it's tiny. It's like a diabetic pen that they give you. And you basically pinch a roll of tummy, and you just put the needle in, and you've dialed the right amount of drug, put the needle in, and you push the pen and it injects. In it went in so quickly, it didn't hurt, and afterwards I thought, what did I make such a fuss about?
The next step was to collect Libby's eggs, to take them out of her ovaries. Dr. Collada explains how he prepares for this procedure.
So this is a trolley that's set up for egg collection. This is a sterile sleeve, sterile condom, sterile needle guides, and I'm going to dress the transvaginal scan probe that I'm going to use for egg collection, because egg collection is normally done through the vagina under ultrasound scan guidance. And this is the transvaginal scan probe.
The probe is first made completely sterile. From inside the womb, it will supply ultrasound images to guide him. It also carries the needle, which he'll use to remove the eggs.
I'm now going to fix the needle guide. And if you look at the ultrasound scan screen, this is the top part of the vagina, and the tip of the scan probe will be there. And if you look at this dotted line, the needle that I'm going to use to collect the eggs, which is here, will go through the needle guide, and the scan probe will be sitting inside the vagina. I'm going to puncture the top part of the vagina and then go into the ovary and collect the eggs from the ovaries.
Inside Libby's ovaries are dark areas called follicles, each containing some fluid and an egg. The follicle at the top left of the screen can be seen closing, as the egg and the fluid are drawn out through the needle. The egg leaves the follicle, comes along a tube, and is collected in a glass container outside the body.
So you can see the ovaries.
The egg is then checked by an embryologist to make sure that it's completely healthy. In Libby's case, 7 eggs were collected. On the screen here are 3 eggs, each surrounded by its protective fluid.
In my situation, because I've got a low sperm count, it turns out it's low. It wasn't 0, obviously. It was low.
And they said they only needed 1.
Yes, quite.
Yeah.
One little swimmer. And so what you do is, while Lib is going through all her stuff, I was asked to, over a period of time, deposit about 4 or so samples.
Simon's sperm samples were treated in the lab to try and get from them as many active sperm as possible.
I basically work as an embryologist. Lots of people don't know what an embryologist is. Basically what we do, as the word says, is work with embryos. In this case, because this is reproductive technology clinic, this is human embryos that we deal with. So basically what we do is create human embryos and look after them until the time that we will put them back inside of the woman's uterus and hope that they will implant there and produce a pregnancy.
Marta counts Simon's sperm, using one button to count the living sperm and another to count the dead ones. Then everything will be ready for fertilization, when egg and sperm will be brought together to create a new life.
My name is Yaku. I'm one of the embryologists here. And what we're looking at is a sample of sperm swimming around. And we're trying to find the one that is most normal looking in terms of the tail and the head morphology. And I just need to pick one. And what we do is we immobilize the sperm by hitting them on the tail. And there's two reasons for doing that. First of all, we need to make sure that it doesn't move, because we're actually going to inject it right into one of the eggs. The other reason is because there's an artificial procedure. We need to prepare the sperm for what's happening next. And because it's not a natural environment, by actually hitting it on the tail, you stimulate the sperm to prepare for the fertilization that's going to follow. So I'm just sucking the sperm into the needle, tail first. And now we're going to move the sperm to a separate drop where the egg is kept. I've got the egg in position now, and it's held there by the holding pipette. So I'm bringing the injection pipette right into position, right in the center. And I'll be pushing my sperm down the needle right to the edge. And I'll start injecting my egg. I need to pull back on the injection pipette, and the sperm will move back slowly, just to make sure that I have actually broken the membrane of the egg. When I see that that has happened, I can inject the sperm into the egg and know that fertilization will take place. And there is my sperm right in the egg. This egg is ready to be released and to be put away into the incubator for fertilization.
So off we went, and it's kind of a surreal experience leaving the clinic, knowing that, you know, your eggs, my eggs and your sperm are left there to sort of, it's almost like you're saying goodbye to your children kind of thing.
Using refrigeration techniques at very low temperatures, eggs and embryos can be frozen and kept for long periods of time. Several of Libby's eggs were fertilised with Simon's sperm, not just one, and some of them were frozen and stored. But storage presents a special problem. How to label all the eggs and embryos correctly. Enormous care is taken to prevent somebody's embryos being labelled with someone else's name. Containers are labelled on both the lid and the bottom of the container. All procedures are carefully recorded. And 2 embryologists, not 1, check all the labelling. Meanwhile, Libby and Simon had to decide how many of their embryos should be put back into Libby's womb.
They could put either 2 or 3 back. And that was really hard. That was a really hard decision, because you instantly think 3, let's put 3 because there's a higher chance. The more they put back, the more likely it is to happen.
I want you to have 1, because obviously twins or triplets, more risk for the children and for the mother.
3 days after fertilisation, it was time for reimplantation.
The first thing they did was bring in this little dish and show us the embryos on a screen. So we saw them before they were put back. Absolutely amazing.
And you see the cells, and you see them moving around in the fluid. So you see each of the 2 embryos, and you saw, you could count the cells, you can see it.
And floating around the screen.
Unbelievable.
So, you know, so you get to see them before they're even put back, and you can just look at them thinking, please, please, come on.
Just as ultrasound was important in egg collection, it's also crucial to the reimplanting of embryos. It helps the doctor place them in the best possible spot in the lining of the womb.
Now, it's important that embryos do not lose heat. So this is a heated stage at body temperature, 37 degrees. So she's going to put them on there.
All right.
So I'm turning on the...
Professor Kraft will do the re-implanting, assisted by embryologist Lucy Allen. Lucy has the care of the embryos.
5% carbon dioxide. I'm now going to load the embryos into the catheter and look through the microscope, which magnifies them by 50 times.
Without a microscope, it will be impossible to see the embryos. Although they're growing, they're still very small indeed. To give an idea of how small they are, an embryo on the left has been photographed next to a pinhead through a microscope. 500 embryos could fit on the head of the pin.
Here are the embryos, and here you'll see these. There they are. We're on day 3 today, so we want them to be a good cleavage stage, and they'll look good.
Cleavage is the division of cells inside the embryo. Libby was to have just 2 embryos re-implanted. Lucy draws them up into a tube called a catheter.
So I watch the embryos go up into the catheter.
While Lucy gets the embryos ready, Professor Kraft prepares his patient for the procedure.
We're going to try and see if this catheter slips in. It has a little air, fluid and air, and the little air, you see it on the ultrasound machine afterwards, so you might actually see this going in a second.
The screen shows the embryo inside a bubble of air and fluid as a small white dot going upwards towards the top left-hand corner of the screen.
Just what you want. Now I'll pass it back to Lucy, and Lucy's going to check that they've gone.
It's important to double-check under the microscope that the embryos have left the catheter and stayed safely inside the womb.
It's fine.
It's fine. Fine?
Okay.
Fine, thank you so much. Good.
The ultrasound has a playback facility, so Professor Kraft can show his patient exactly what he was doing.
Now, we'll replay it for you on the replay system. So you'll see a little tiny catheter coming up here. Here it is, the end of that's the catheter we put through the cell. Here you see it going, and it's going forward, and I'm following it through. You can just see the end there. And then I come back a fraction with it. I put it back a fraction, or a centimetre or 2. Then I put it in. There's your little air. So you now know that it's in the right place.
It will be 12 days before it's known whether one of the embryos has started to develop successfully. Professor Kraft visits his farm in the West Country, where he has rare breeds of cattle and pigs.
And then one has to realise that animals are very similar to the human animal. I don't think people talk about animals in the right way usually. They treat them rather as second-class citizens or animal species, when some of them, like our large black pigs, are highly intelligent. They really are intelligent. So we have the same things when you think about reproduction of humans. You have the same things going on in animals.
Centuries of studying animals and breeding them have added to our knowledge about reproduction and about possible causes of infertility.
One of the things I don't think the general public will realise, even young people, is that probably in some young people, and I wouldn't wish to frighten them, there are aspects about their biology which are not perfect. They may outwardly be perfectly normal, but they don't realise that their semen, for example, in a 16 to 18-year-old may be quite low, and it will be something that they've inherited from a genetic point of view. So it's an imperfection. But those people can now be helped by IVF.
Libby and Simon are still waiting to hear if she's become pregnant.
They send you off and say you can either do a home pregnancy test, or you can come back in exactly 2 weeks and have a blood test here. And a blood test is absolutely yes or no, so we opted to come back for a blood test.
And also it was quicker.
But those 2 weeks were the longest 2 weeks of my life so far. I just didn't dare to even believe that it had worked. I just didn't want to think about it. So we drove into London and we went into the clinic, and it was the nurses were really busy, and Dr. Carby, who first saw us on our first appointment, said, "Oh, I'll do Libby's blood test. And then you can either sit and wait in the clinic for 40 minutes,
yeah,
or you can
push off.
So we went off for a little wander, and that was just
Let's take a wind
5 minutes, you know. How long's it been? It's been 3 minutes since you asked the last time.
I remember, just saying to each other, look, whatever happens, we'll deal with it. It's going to be fine. If it's worked, fantastic. If it hasn't, well, it hasn't, and it's meant to be, and we'll deal with it.
Yeah, and I can remember staring at the floor, holding your hand, and the only thing I could think was, when they tell you it's negative, do not cry in front of them. Don't cry in front of them, accept the news, get in the car, and then you can cry. And I couldn't look at her when she came in, and I was staring at the floor, and, you know, deep breath, and she said, I'm pleased to tell you that it's a positive, and you hear the word I'm pleased, but it doesn't kind of sink in, and you hear the word positive, and I was like, you know, I couldn't believe it. What? Tell us again, and she, you know, told us again, and they showed us the slip of paper, which in bright red pen is written positive 18th of December. And everybody came rushing through, and, you know, congratulations, well done. And as we were leaving, Andrew on the reception said, that's the best bet, I bet that's the best Christmas present you'll ever have.
Incredible.
Yeah.
For the next 9 months, life for Libby and Simon went on as normal. Libby's pregnancy, though it was achieved with the help of real science, continued in exactly the same way as a completely natural pregnancy, including the parents' excitement at feeling the baby move inside the mother.
First feeling her move was amazing. I had this little flutter at about 17 weeks. It just felt like a little butterfly. And then I didn't feel her again for about 3 weeks.
It was just fantastic to feel her move, because Lib had been feeling her moving for a while and I hadn't. And just when you put your hand on Libby's tummy and just feeling that little kind of kick or a hand or whatever it was just brilliant. Kind of, it's like a next step of reality that, my God, you know, there really is a baby in there.
We decided to go for the elective caesarean, which is basically being told a date when Lily was going to be born, and they do a spinal block, take you into theatre, do a spinal block, so deaden you from the waist down, and literally remove her from your tummy.
We saw Lily being taken out of Lib's tummy and held in front of her. I can still see really clearly in my mind a picture of the 2 embryos. One was 7 cells and one was 8 cells, and I can see it float. You see it they show you it on the screen before they then put the embryos into Lib, seeing them moving around. And now look, you know, there's Lily, and it's just incredible to have seen that microscopic embryo, which is, you know, tiny, tiny, tiny. And now here she is. It's just humbling and choking, really. It's amazing. I think it's fantastic.
But the other big thing for me was when she was born and them handing Lily to Simon. Having been told by a GP that Simon would never father a child, to see Lily in Simon's arms, I thought my heart was going to explode. And I still get that now when he's with Lily. It's just absolutely mind-blowing that, you know, there she is.